Hi, my name is Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'm going to talk to you about the risks and potential complications of an arthroscopic excision of calcium from the rotator cuff. What are we talking about? Well, what we're talking about is something like this. This is an MRI scan of a patient who has a lump of calcium in their rotator cuff. So this is the humerus, the ball, the socket, the shoulder blades here, the acromions there, AC joints there, collarbones there, skin, deltoid muscle. Now this is the rotator cuff here, the supraspinatus muscle on the top of the shoulder. It forms tendon. The tendon comes across the top of the shoulder. You see the layer of cartilage there, and then it joins onto that ledge of bone there. And in that is that black lump there. That is calcium. It's homogeneous and it looks like calcium. So calcium very commonly deposits in tendons. It tends to deposit in tendons all around the body. The shoulder is a particularly common place for that, probably because there's just so much tendon in the shoulder because of the rotator cuff and the size of it. The calcium can sit there and not cause any problems. If you went out on the street and took 100 patients, we think about 10% of them probably have calcium and don't even know about it. But something will trigger and your body will try and remove that calcium. You get an inflammatory attack against that calcium to try and remove it. And it's the inflammation of that attempt of the body to remove the calcium that causes all the pain. The pain can be severe or it can be grumbling and more chronic. The answer to the problem is to take the calcium out. If the body is unsuccessful in removing the calcium, then the plan is then to remove the calcium. There are two ways to do that. One is via a big needle being put into it under ultrasound guidance with the radiologists, and they can suck it out. If it's a soft deposit, if it's hard, they'll break it up and hopefully that will help it be resorbed. So calcium can be soft or hard. And the other option is to remove it surgically, and that's with keyhole surgery, and you go in there with a little shaver and curette. You can see the curette there, and remove the calcium from the rotator cuff. The tendon will then heal and recover by itself. So that's what we're talking about. When I talk to patients about this, the things to talk about are the risk of infection. It's 1 in several hundred. It's very rare. There's a risk of frozen shoulder. Anytime we operate around the shoulder, there is a risk of triggering a frozen shoulder. Frozen shoulder will go away, but it can be pretty miserable until it does and can stay around for a while, and you get pain and stiffness with that. Nerve injury, exceedingly rare. 1 in thousands would be the risk. DVTs, hematomas, all those sort of little medical problems can happen, and you have a general anesthetic, so there's a risk from the anesthetic itself. There's not a lot in the literature to look at. There are several scientific papers that are listed here. If you scan the QR codes, it will take you directly to those papers to look at. But overall, complications were extremely rare. Frozen shoulder was the commonest complication seen. It ranged between 1 to 6% of patients that had the surgery. And just of interest, there were 2 cases of ossifying tendonitis, and that's where bone formation formed in the tendon after the calcium was removed. That's a very rare, almost bizarre type of complication, but it's something interesting to mention. So that's a rundown on the risks and potential complications of excising calcium from the rotator cuff as an arthroscopic procedure. I hope that helps you understand it better. Thank you for listening.